So obviously, depending on where you work, you're going to need to know how to manage trauma surgeries. If you're in a trauma center, definitely you're going to be managing traumas. Generally, these organizations have the three different shifts and a lot of support on call. I worked at a hospital, UCI Medical Center, that was a Class 1 trauma center, and they not only did they have the three, day shift, PM shift, and a night shift, but generally in addition to the night shift, they also had two teams that were supposed to come in the event of a trauma. So you had an A team and a B team. That's in addition to the night shift. So you could, depending on what's going on, have three teams in there working. Okay? Because if you're a trauma center, you have to assume that there are going to be traumas. And generally on the night shift is when you have a lot of that activity that could cause people to get into trouble, drinking, going out to bars, partying, those kinds of things. So just be aware of your hospital, your institution's staffing, and because if you're on a call, if you're someone who's coming in for a trauma, you need to be ready for whatever kind of trauma comes in. Obviously, one of the main considerations for trauma is the mechanism of injury. Obviously, if it's a bullet, it's going to be different than if it's a motor vehicle incident. So you need to know, of course, how to manage surgical procedures or how to manage emergencies, injuries related to the particular mechanism of injury. Okay, so they talk about deceleration forces, acceleration forces, and blast forces. Okay, so obviously, too, in a military hospital, we're going to be dealing with a lot of blast injuries and deceleration. That's your head injuries, right? The contra coup injuries. Okay, so you just be aware of the types of blast injuries, whether you high velocity and low velocity missile or wound projections. You want to be aware of those types of things. A lot of times, too, in a trauma center, you will have somebody who will sort of do like a recon mission. So you'll hear about a trauma coming in, and so one person will generally go down to the emergency room to look to see what is the trauma. So when they hear the trauma called, somebody will go down and look at go to the ER, and they'll usually call back and say, okay, this person is a head injury. They're definitely coming to the OR. Go ahead and get a cranial room ready. Or this person is a chest injury. Go ahead and get that ready. Abdominal injury, whatever it is, so that they can kind of give the team a heads up. So usually in those institutions also, you always have one room set aside for those traumas that are coming in, especially if you're a trauma center. Okay. Obviously, in the ER, they'll be getting those different lab tests to diagnose those injuries that are OR worthy. There are sometimes that not all traumas or not all emergencies are going to come from outside of your institution. You do have traumas that are going to be generated inside of the hospital. One of the ones they talk about in the book is compartment syndrome. So after certain types of orthopedic surgeries, there may be conditions that develop in the patient that are emergent. So that person would come back and be worked on or treated in that trauma room. Many times hospitals will do procedures in the cath lab, and depending, they used to, not so much anymore, but it used to be every time they did a certain type of procedure, it was a PTCA, they would always have an OR on call or available in case they had to rush them to the operating room for open heart surgery. Of course, they've gotten much better at it, so you don't necessarily have to have a person, you don't have to have a room open for a heart just, you're not on pins and needles, but that consideration is always something you have to be aware of. That if they're in the cath lab and they get into trouble, they're going to have to come in for an emergent open heart surgery. So just be aware of that. It kind of goes into, again, those things that we talked about as far as planning and setting up quickly. They go over the rapid sequence intubation, how you place cricoid as you're assisting the anesthesia provider, putting in that ET tube or having that patient go to sleep emergently. Okay, obviously they talk about elderly trauma, bariatric trauma, pediatric trauma. So depending on what your hospital manages, obviously talking to the patient and family as you're trying to comfort them that their family member is in good hands, and of course you're going to have to be aware of transplant opportunities in case the person is brain dead, and of course end of life in case they expire. So you need to be aware of the morgue procedures and and whether it's a coroner's case, those kinds of things, and then preparing the body for transfer to the morgue, the shrouds and the special gurneys. I think we talked about those. We talked about it sort of with the organ procurement, because that's something that has to be considered. Okay. Again, they go into all the different types of injuries: face, eye, neck, heart, contusions, abdominal injuries, to urinary, skeleton, hypothermia, and thermal injuries. So please just review again all of your types of surgeries. Recognize that, again, you'll have to possibly be dealing with organ procurement organizations as you're either keeping those people alive or harvesting organs. Again, the malignant hyperthermia and Code Blue PowerPoint is on the Blackboard. You probably will. It's available. It's already available. It was available. It's available now, which of course is Saturday night, but you'll be probably getting this either Sunday night or Monday morning. Okay, so enjoy. See you guys later. Okay, bye.